What's going on, everyone? I'm just a typical, average American here today to react and learn about these Canadian healthcare stories. More specifically, what's interesting about these, it's Americans who had an experience with healthcare in America and then had an experience with healthcare in Canada, and they're kind of comparing those two experiences, which just sounds absolutely fascinating. I think it's kind of well known, at least in America, that Americans, healthcare is kind of a hot topic for good reason, and a lot of Americans look towards Canada as like a shining example of what life could be like with like a better system. And honestly, I'd say you can have a decent experience with American healthcare if you have an insurance plan that you're paying for every month. Most people do. It's really, you're going to be okay a lot of the time kind of situation, but when things go bad and you encounter something in life where you're not covered for it in America, and goodness knows nobody can tell you what you're covered for and not covered for. You're basically going to figure that out when you get to the hospital. There's a million horror stories like that, and finding out that you've come down with some kind of ailment or situation where your insurance doesn't cover it and you end up owing an outrageous, life ruining amount of money. There's lots of stories like that, and right here in this video, I think we're going to hear a bit about that and how that compares with their experiences dealing with that in Canada, which sounds very, very, very interesting to me and enlightening because I don't pretend to understand all of it. I don't understand the Canadian healthcare system perfectly, but this should probably help and be pretty educational, honestly.
So I was living in California and I met my husband through some mutual friends and we fell in love and decided to get married. There was only one small problem. He was Canadian. So we
Okay.
flipped a coin.
So, only one problem. Only one problem. He's Canadian. No, no. That actually sounds like it ended up being, I'm thinking, working in her favor, honestly, if these are healthcare stories.
And we decided to live in
Wait, what did she say?
He was Canadian. So we flipped a coin and we decided to live in Canada first. And
What?
here I am in
Wait, what? Wait, what? Wait, what? They actually flipped a coin? Wait, I mean, I guess if you gotta decide, is that really the only way they could decide? They flipped a coin and then we're going to Canada. Okay, who am I to judge? You gotta figure it out somehow. Why not?
and we decided to live in Canada first. And here I am in
Okay.
beautiful British Columbia.
I'm
Okay.
originally from California, born in Los Angeles, grew up in
Okay.
Palo Alto. And I came to Canada in 1975 with my husband and my youngest daughter because he had been offered a fellowship at the University of British Columbia.
When our son
Oh, so we're following two stories here. Two stories. This should be good.
Our son Sam turned 4, around the time he turned 4, he developed a rash on his body and he started to complain about his bones hurting. So we sent him to a dermatologist for the rash and a pediatrician for muscle weakness.
See, this is the point already where a lot of American families would already like be nervous. Not only because their child is sick and in pain, that should be isn't that sad? That should be the main worry, right? That should be your only worry, trying to get your child feeling better and helping them through pain. No, there's many, many families and situations in America where that's not the only concern. It's also, oh boy, what is this going to cost us? And that is sad to say the least.
And after some initial appointments, a dermatologist told us she suspected he had this rare skin and muscle disease called dermatomyositis. Without proper treatment, a third of children with dermatomyositis will die, and a third will be severely handicapped.
I was teaching
Yeah, wow. Yeah, this is like I can already tell this video is already going to be like sad, but hopefully with happy endings here that include Canada causing that happiness. So that's good.
In Nanaimo. And I started
Nanaimo? Wait, that's where they invented the Nanaimo bar. I learned that. I don't think that has anything to do with this video on Canadian healthcare stories, but she was in Nanaimo. What do you want from me?
in Nanaimo. And I started having bleeding from the intestines, and it turned out to be a very, very rare autoimmune disorder.
Wow.
Acquired type von Willebrand's, which
Yeah.
nobody seems to know much about.
After she diagnosed him, it was only 6 days later when we were at Children's Hospital, and they admitted us immediately. He had 4 days of intravenous steroid treatments.
Wow.
And we've spent the past 2 years, he's 6 years old now, slowly weaning him off of his medication while monitoring any disease activity.
So I had to retire early when I was 60. And
So she was actually, this individual here was actually in Canada when she came down with her autoimmune disease. And the other case study, the other woman, was in America, if I'm understanding correctly, trying to treat their 6-year-old son.
from that point on, it has never been possible for me to go back to California because I knew I could never be covered by insurance there.
Oh, that's why this video, if you look at the title of this video, it's called Can't Go Home. Is that what that is? So these are Americans who are currently living in Canada who literally will not move back to America because they know the healthcare costs would be prohibitive. They literally could not afford to go back to America and live there because of the healthcare costs compared to Canada. That's all you gotta... This is like the perfect black and white example. Like, that's all you gotta learn to see that something's wrong with the American system, right? All right, let's continue.
When Sam was first diagnosed, my friends in the States had one of two reactions. They either said, "Oh, are you coming down here for treatments?" Or they said, "Can you afford this?" And to me, both of those things seemed ridiculous. We've had amazing care in Canada.
Oh, actually, okay. I'm glad she clarified that. It sounds like she was also in Canada as well. That's right. That's right. They flipped the coin and went to Canada. I literally said that. All right. She was the one that flipped a coin, is in Canada. Well, that ended up being a really, really, really lucky thing that coin landed on Canada, and they ended up going there. And she basically is saying the same thing, huh? Her friends, her American friends, were asking her, well, when are you going to come back to the States? And I can already tell, she's saying, oh, no, we never, because we want our son to survive. And that means getting medical treatment, and that means treatment we can afford. I hope they go over how much it costs, actually, in America. How much it would cost. So that would be interesting.
Or they said, "Can you afford this?" And to me, both of those things seemed ridiculous. We've had amazing care in Canada. He has a team of pediatric rheumatologists that are world renowned.
Yeah.
And the costs have been a non-issue. We simply pay our monthly payment of $108 a month, and we march in. We don't fill in any paperwork for him to see the doctors, and it's all good.
This is, I say this a lot, but this is sad how much it's blowing my mind. How, like, hearing this firsthand experience, especially from an American as well, who's like, no, there's nothing tempting me to go back to America in the way of a better healthcare experience. So I do think, like, she could get a very, very good, very, like, highly skilled healthcare treatment in America, but that's not the point. The point here is she's getting that in Canada, world-class treatment, and she's just paying so basically you're paying monthly payments, and that's where I don't understand exactly if there's private healthcare insurance plans or if that's to the Canadian government, perhaps. And I know paying taxes has to do with paying for your healthcare as well in the form of taxes, but yeah, all Americans are basically paying for health insurance plans monthly, and then you end up going in for a treatment or something, anything out of the ordinary, and lots of ordinary things, if I'm being honest. And then you go home and you get a bill in the mail, and you basically have no idea what to expect. I've had to go to the emergency room several times, and I've had like $1,000 bill come back for certain things, and you have to try to. There's wording on the bill. It's like, call us, we'll work out a payment plan. You know, all sorts of kind of scary things where you want to live, you know, in a place where you feel like you can just focus on getting medical treatment, and that's the primary concern. And also, by the way, you with medical care, that happens to be like treated like a business in America. And that's the one business where you have to be a customer. You need medical care. Everyone needs it. Like, you're willing to, and you're basically willing to pay whatever you can to get it. And it feels like that's kind of used against you in America. I don't know. Like, I could just go on and on and on about this, but something about hearing about her positive experience in Canada right now is really making me think deeply about how messed up this is.
Any paperwork for him to see the doctors, and it's all good.
There
Yeah.
is something that was discovered fairly recently called Factor 7, and time before last, when I was in the hospital here, they gave me that, and it seemed to work. The interesting thing is that the Factor 7, I don't know exactly because I never get a bill for anything, but
Ah! Oh, it's so funny and so sad. She's like, she's like, I don't even know how much it costs. I never get a bill. And it's like, that's nice. That is nice. That is, I'm turning into that one of those Americans who's like, hey, Canada, look at Canada as for an example of what we could do. Please, is anyone listening? I'm turning into one of those.
I was told that it was about $60,000 a dose.
What?
But I was told that it was about $60,000 a dose. And I was given 4 or 5 doses in the hospital. And
Huh?
the interesting thing to me,
Oh, no, no, no. If you were in America, your insurance might pay like a certain percentage, but at best, like you would get at least like $10,000-$20,000 bills for each of those, I'm thinking. So she would have ended up probably owing like $60,000 to $80,000 on those treatments. It sounds like if each of them were 60,000. I don't know. Healthcare plans and deductibles and percentages change like depending on what plan you have, but this sounds like a literal perfect example of a situation where in America you would really, 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 for lack of a better word, be screwed.
is that I have never been told that I couldn't receive a treatment here because of the cost of it. I don't even know the cost of these things.
When I was researching the cost
Wow.
of healthcare in the U.S., I asked some other Americans on a message board about his disease, what the costs have been to them. And that's when I discovered that our out-of-pocket costs for care would be between $45,000 and $165,000 for
Yeah.
6 months of treatment.
Yeah. I mean, it's blunt to say, but obviously for many Americans in that scenario, that would mean that your child is probably going to die if you can't come up with $100,000, which the vast majority of people cannot. I guess you could be on like a payment plan the rest of your life. I don't know. It's obviously like horrible to think about, but I think it's worth saying and thinking about because it's a reality and it's like a horrible reality for lots of Americans.
I realize I have no idea what the costs have been in Canada for his treatment because we've never seen a bill.
Yeah, I would like to spend whatever time I have left, my remaining years, closer to my children and grandchildren.
Wow.
And I certainly can't do that under the circumstances with the present healthcare situation in the U.S.
Oh, she can't visit her grandchildren and her children in the US because she has to stay in Canada where she can afford to get her treatment. This is sad. This is sad for many, many, many levels and reasons.
I'm interested in moving back to the US because I miss my family and I want my child to be raised near his grandparents and his aunts and uncles. And I also just miss my country. I began to investigate what it would take to move back to the States, and I immediately thought of healthcare as a concern because of
Yeah.
Sam. And I called a number of private insurance companies and was told outright that we would be denied coverage based on his pre-existing condition.
Yeah, that whole thing. Oh my gosh. I'm glad she said that. That's another thing with, I was kind of touching on with American health insurance. There's just random things you can come down with, random illnesses and conditions where your insurance company will be like, we don't cover that. We don't cover that one. No, that's not in the fine print. And then you're just like, what? Wait, what does that mean? And they're just, we don't cover it. You pay for that. You pay for that. And it's like, oh, yeah, that is it's wild. So, like the other woman, she can't return to America either, even though she's looked into it. I'm glad that they're actually talking about some of the pricing and cost, because that kind of makes it very blunt how unattainable it is for a lot of Americans.
Told outright that we would be denied coverage based on his pre-existing condition. I then looked into what government programs were available, and the S-CHIP program has an income cap of $45,000 a year, and we exceed that.
So what I have
Oh.
is
So her family earns more than 45,000 a year. So the American government would be like, "Oh, you earn too much money. We can't help you pay for any of your treatment."
disability, Social Security. And they wrote me a letter and said, don't.
Oh, she also asked the American government for help too.
So what I have is disability, Social Security. And they wrote me a letter and said, don't ever bother to apply for Medicare because you are not eligible.
I worry if my mom's cancer came back, I couldn't go down there and care.
Medicare as in like financial aid.
I worry if my mom's cancer came back, I couldn't go down there and care for her and
Yeah.
see her live out her final days.
As an American
Yeah.
citizen, it seems to me that I should have a right to spend my last remaining years back in my home country with my children and grandchildren.
Yeah. And also like every American pays taxes and stuff. Like there's a million reasons why this is messed up, but like Americans are paying taxes and stuff, and for some reason that's not going towards helping every American like with their healthcare. You'd think if we're like on a very, very basic philosophical level, when the first civilization made a government, that you'd think one of the thoughts behind that was, oh, the government, it's there to like help take care of everyone. And somehow America has completely dropped the ball on that with healthcare.
Living in a country which has universal coverage, I've experienced both systems.
Yeah.
And the system in the US is not fair for middle income people or for low income people.
Right.
I'm just going to be extremely disappointed in the American system and the way that it works
Yeah.
and the people in Congress.
I mean, that being said, it is nice that these two individuals do live in Canada and can get the treatment they need. Her with her like $60,000 injections or whatever she's getting for her autoimmune disease, and the other lady keeping her young son alive as well. 30% of kids with that disease end up dying. So it is nice that they're getting the treatment they need in Canada. Thank you, Canada. And it's sad that they literally can't do that in America.
To me, healthcare, it's a human right. It's not a privilege.
Certainly is the point of having a government. Okay, that's it. Wow, that got me kind of worked up, this video. This video is by Turtle Box Productions, and I give it a like. I gotta give it a like, because that was very educational, mildly infuriating as well. I really did appreciate that this was uniquely from the perspective of two Americans getting treatment in Canada and trying to move back to America, but they can't. It's like the perfect example of what's wrong with everything and why Canada is a shining example of healthcare that America should definitely look towards. But at this point, we've had a lot of time to look towards Canada for how to handle healthcare, and we haven't changed anything. So it's looking a bit grim on that front. So sadly, many Americans, I think, have basically had to get used to it and figure out how to navigate this whole situation. It definitely is a sticky, uncomfortable, sad, desperate at times, cruel even situation. American healthcare. Yeah. That is something, man. But I like thinking about these things. I did enjoy this. Anyway, if you enjoyed this video as well, feel free to give it a like or leave a comment. And if you're interested in more videos like this, me reacting to Canada, Canadian culture, things in Canada I've never seen before, feel free to subscribe for more. And until then, thanks for watching, and see you next time.